talk about the underpinnings of the ranking program, our model of population health. Then I'm going to talk about the Philadelphia numbers, just to sort of illustrate how that model works with the data, and also hopefully show you a little bit about how the website works. And then Lisa is going to look at a comparison between the Philadelphia County numbers and the Chester County numbers, both because they are at the extreme ends of the spectrum in Pennsylvania, but also because that's one of the key factors of our rankings, the ability to compare counties within a state and actually around the country. You can compare Philadelphia with any other similarly situated urban area around the country, if that would be helpful. This is our model of population health, which we use to organize how we present the data, but we also use it to guide our work with communities around the country. And it's a framework that we think accurately considers the many factors that impact a community's health. I should tell you that the data we present is not our data. We aggregate data from many sources, and we present the most recent data available within the measures that we present data on every March. So the model, you can see along the left side of the model, 3 boxes: health outcomes, health factors, policies, and programs. If you read that up from the bottom, it's a simple statement that we believe, and I'm sure everyone in the room would believe, that by creating policies and programs that beneficially impact health factors, you'll end up with better health outcomes. Health outcomes is the rank that tends to grab the most attention whenever we put out the rankings at the end of March. That's the number that the media seizes on. If a county is number 1 in the state or number 67 in the state, that's what the media locks in on, the health outcomes number. And that health outcomes number is our estimation of the current health of the county, based on an equal look at the length of life and the quality of life of residents in that county. But there's a second ranking that we put out, the health factors ranking. Regrettably, it doesn't get as much attention, at least in the media. It doesn't always get as much attention from policymakers or even community activists or advocates. But really, it is the number, I think, that folks in this room probably are more interested in. It is our estimation of the prospective health of the county based on an examination of the many different factors that impact community health. And so if a county has got one number for health outcomes, the snapshot in time of their current health, that can be a good number or a bad number, but the real action, I think, is what does the future look like, and what does a county have to do, or what does a community have to do to improve their health or maintain their good health going forward. So the health factors ranking looks at 4 separate clusters of indicators. And those clusters are lined up, the darker blue boxes down the middle of the model. They're not equally weighted. You'll see different percentages assigned to the different clusters. But those clusters are health behaviors, clinical care, social and economic factors, and the physical environment. And clearly the social and economic factors is the dominant cluster, which aligns very well with the word map that came out in the polling just a few minutes ago. That's really where we think a community can significantly improve the health of their residents by paying attention to the education, the employment, the income, the family and social support, and the community safety in their neighborhoods and in their communities and counties and cities. And so those factors are weighted at 40% of our overall health factor ranking. Health behaviors, which are clearly and closely correlated to income, if you look at through the list of health behaviors, that is the second most dominant box at 30%. And then down from there, 20% clinical care, 10% physical environment. Now when we get to the rankings, you'll notice that we have a variety of data sets or data points that we present to put numbers with these indicators. Quick example, tobacco use is the dominant individual measure within health behaviors, but we only have one data set for that, which I'll talk about in a moment. Whereas with diet and exercise, we have 4. I'm not, because I'm not a data scientist, I'm not in a great position to explain precisely how our team back in Madison constructs the insides of the model as opposed to the outsides of the model. But suffice it to say that if you go down the right side of the model, I'm going to take a quick count. It looks like we've got about a dozen or maybe 15 separate categories of factors, but we have at least twice that many actual measurements and data presented under each. So I'm going to swing to the numbers for Philadelphia. So while I'm here and looking at the Philadelphia numbers, just to show you how the model operates, I'm also going to try to give you a sense of how at least this page of the website operates. The website is very user-friendly and it's very rich. It's got a lot of resources. It's all free, including the coaching team, which is not a virtual resource, but the coaching team, the work we do around the country with cities and neighborhoods and regions and counties, that's all free as well. But the website itself does have a wealth of information beyond the data, and it's all free and it's pretty easy to navigate. This page that I'm on right now is what we would call a county snapshot. So it gives you a very quick look at the numbers for Philadelphia County for 2017. Before I lose the point, let me just say that right next to the word Pennsylvania, you'll see this drop-down menu, and you can go back in time and look at Philadelphia numbers all the way back to 2011 if there's a need to do that. One caveat I point out, over time we do tend to tweak the, not the model, but the measures. Some measures are added, some measures are deleted. So you can't do an apples-to-apples comparison from, let's say, 2011 to 2017, but you can certainly get a general trend of how things have gone in any county in the state or the country by going back to the 2011 and forward. So looking at, again, that first number, the health outcomes number, every March when we put the numbers out, as I said, that's the one that the media grabs on. And it's a little disconcerting because, honestly, the more significant number, the more impactful number is that health factors number. But the health outcomes number looks at two things: the length of life in a community, the quality of life in a community, the quality of the physical life in the community. And so we only have one measure for length of life. We have four, as you can see, for quality of life. But those two measures are equally weighted, 50-50, and it gives us a number. And in this case, the Philadelphia number is 67. I'm going to hold for a minute to explain how you find out more about the particular data sets, because when I throw out a number like the premature death number in Philadelphia County is 9,500, that doesn't make a whole lot of sense unless you know a little bit more about where that number comes from. What you do for any of these measures, you click on the measure and it'll take you to a back page a back series of pages that will give you more data, more explanation of where that data comes from, what it means. The meaning of the premature death number of 95 is the years of potential life lost before age 75 per 100,000 population. Our team has determined that any life ended prematurely or before age 75 is a premature death, and so the number of potential years of life lost are calculated using that number. Somebody dies at 72, 3 years go into the number. At 52, 23 years go in. One thing I would note about that particular measure is that regrettably it's rising. For the first time in a long time, the rate of premature death in the United States is rising, and the spike is seen primarily among younger people, which obviously has a more dramatic impact on the number mathematically. So dropping down to the health factors number, the first thing I would note is that we don't see that similarity between health outcomes and health factors as commonly as you might guess. Philadelphia, obviously, it's 67 in both, 67 out of 67. We actually see, a gap in those two measures fairly frequently. not so much a dramatic gap, but you know, in any given state, there might be a 7, 8, 10, 15 county gap between health outcomes and health factors. And where that gap is going in the right direction, in other words, where the health factor number is better than a health outcome number, that's great news. Where it's going in the opposite direction, obviously, that's very challenging. And in Philadelphia, the numbers are obviously very challenging in both health outcomes and health factors. It should be noted that the reason why we like to focus on the individual data sets and the comparison of those numbers is because Philadelphia could do everything under the sun to improve the health of its community in all of the measures that we rank. And it could still be 67 next year if the other 66 counties keep pace or improve. So it is, the county by county comparison has, for my purposes, has less value than the individual measures. If you really want to figure out what's going on in Philadelphia County, you got to look at these individual measures and figure out where among the individual data sets improvement is required. So with that in mind, I'll take a quick look at health behaviors. I think I said before, adult smoking is the most heavily weighted factor in health behaviors. And you can see that in Philadelphia, the adult prevalence is 20% versus 18% for Pennsylvania and 14% for the top performing U.S. counties. So adult smoking in Philadelphia is a significant driver of that overall 66 ranking for health behaviors. While I'm here, I'm going to go back to this series of back pages to tell you a little bit more about the data, because I want you to see, among the other things we show you, we have a map of Pennsylvania, so you can see graphically where the counties with the most challenge on adult smoking are. The data will just list for you county by county the numbers. The description goes into where we get the data and why we present it. But this last tab here, policies, that'll take you to a part of our website that catalogs policies or programs that have been utilized around the country, mostly at the local level. We do have some statewide policies. We do have a couple of federal policies as well. But for the most part, our What Works for Health database catalogs policies that have worked by topic area. So adult smoking, you can see that we have what looks like about a dozen or so different innovations that have been tried at the local level, and our team back in Madison rates them for evidentiary strength. We have several rankings, or ratings I should say. Internet-based tobacco cessation interventions are scientifically supported. For example, let me find one that is actually, looks like all of these. Here's one down here, school-based tobacco prevention skill building programs, some evidence. You can, using our website, you can figure out what we mean by those different ratings, but clearly scientifically supported is a much stronger rating than some evidence. So for any particular topic, any particular community health challenge, you can use that database, plug in the search term, and it'll kick out a range of strategies that have been tried at the local level to address that particular problem. All right, so going down quickly in the Philadelphia numbers, you can see pretty consistently challenging numbers. Health behaviors, 66, clinical care, 62. The biggest driver, social and economic factors, 67. Physical environment, Philadelphia always does well. It does well for two reasons in particular. One, because of the mass transit, because less people drive to work alone. That's a positive. Two is that you apparently have some good water in Philadelphia, or at least you don't have a drinking water violation in Philadelphia County, and that drives that number as well. I was out in Pittsburgh not too long ago. Allegheny County overall has pretty good county health rankings, but they fall apart on physical environment. So they're stronger in social and economic, they're stronger in health behaviors, they're stronger in clinical access, but they have a really bad number in physical environment. Real quickly, I just want to show you one thing that you need to be aware of is down here below the last of the social and economic factors, injury deaths. Right below that, additional social and economic factors not included in the overall ranking. We provide additional data under most of our categories. The team back in Madison is weighing these data sets, trying to figure out where they belong in the model, do they belong in the model. So they're essentially under review, but for the time being, we think it's important data. We provide them to communities, even though they're not calculated into the actual number. Do want to draw your attention to two brand new data sets this year. The first one, disconnected youth. That is a look at the young people between 16 and 24 who are neither working nor in school. And that number in Philadelphia County is very challenging, 19%. That's compared to 13% in the state and 9% in the top performing U.S. counties. The other new number this year is firearm fatalities, the last one, 20, which also, unfortunately, is well above the Pennsylvania statewide average and the top performing counties in the country. With that, I am going to get us up to this Compare Counties tab. Any two counties or any several counties next to each other. And while I do this, I want to explain it. Well, we do it primarily to get in-state comparisons. We do encourage people to look at other counties around the country that where the comparison is more apt. County is where Las Vegas is, and their numbers are actually pretty good. But as most people would acknowledge, Las Vegas is an atypical city. It's not like any city anywhere in the country. It's certainly not like any other community in Nevada. So he said, well, it doesn't really help us to compare our rankings with other counties in Nevada. We're more like Phoenix. Let's compare us to Phoenix. So he pulled up that comparison, Clark County, Maricopa County, and regardless of what the two ranks are within Nevada and Arizona, side by side, he could see that Phoenix is a whole lot healthier in most of our data sets than Las Vegas. And to him, that was a more valid comparison. So you may have a cause to go outside of the state for these comparisons.